Hello friends, today I am going to discuss question number 10 of Katherine Anderson mrcog part 1. In this video I am going to discuss about urinary bladder stretch reflex arc and difference between reflex and flaccid bladder and about urinary retention. We will discuss this question at the end of the video. Now, urinary bladder, it is an organ of a urinary system that temporarily store urine. The bladder is a hollow organ with distensible walls. It has a folded internal lining known as rhoga, which allows it to accommodate up to 400 to 600 ml of urine in healthy adults. The external features of the bladder, it has an apex which is located superiorly pointing towards the pubic symphysis. It is connected to the umbilicus by the median umbilical ligament, which is a remnant of the urachus. Then it has a body which is a main part of the bladder located between the apex and the fundus. Fundus, which is also in bladder is base, is located posteriorly. It is triangular shaped with the tip of the triangle pointing backwards. And it has neck formed by the convergence of the fundus and the two inferior lateral surfaces. It is continuous with the urethra. Now this is the diagram showing bladder anatomy. Urine enters the bladder through left and right ureters and exits via the urethra. Internally, these orifices are marked by the trigone, a triangular area located within the fundus. In contrast to the rest of the internal bladder, the trigone has smooth walls. This is explained by the different embryological origin. The trigone is developed by the integration of two mesonephric ducts at the base of the bladder, while the rest of the bladder develops from the urogenital sinus. Now musculature. The musculature of the bladder plays a key role in the storage and emptying of urine. In order to contract during micturition, the bladder wall contains specialized smooth muscle known as detrusor muscle. Its fibers are oriented in multiple directions, thus retaining structural integrity when stretched. It receives innervation from both the sympathetic and parasympathetic nervous system. This is a diagram showing detrusor muscle, which fibers are oriented into all the directions. There are also two muscular sphincters located in the urethra. Internal urethral sphincter, thought to be a functional sphincter, no sphincteric muscle present. It is formed by the anatomy of the bladder neck and proximal urethra. External urethral sphincter, it is skeletal muscle and under voluntary control. However, in males, the external sphincteric mechanism is more complex, as it correlates with the fibers of the recto-urethralis muscle and the levator ani muscle. In order to contract during micturition, the bladder wall contains specialized smooth muscle known as detrusor muscle. Now vasculature or blood supply. The vasculature of the bladder is primarily derived from the internal iliac vessels. Arterial supply is via the superior and inferior vesical branches of the interior division of the internal iliac artery. This is supplemented by the vaginal arteries. The obturator and inferior gluteal arteries may also contribute small branches. Venous drainage is achieved by the vesicles venous plexus, which emptied into the internal iliac veins. This is the diagram showing superior vesical arteries which drain into the internal iliac artery. And in this picture you can see superior vesical arteries and inferior vesical arteries shown by arrow, which are interior division of internal iliac artery. And this is the venous drainage showing vesical venous plexus drains into the internal iliac vein. Now, lymphatic drainage, the superior lateral aspect of the bladder drains into the external iliac lymph nodes. The neck and fundus drain into the internal iliac, sacral, and common iliac nodes. So, the lymphatic drainage of the bladder has two different sides. So, the superior lateral surfaces of the bladder drains into the external iliac lymph nodes, and fundus and the neck drains into the internal iliac lymph nodes. As the bladder has two different sides of lymphatic drainage, it is important for carcinoma of bladder. Nervous supply. Neurological control is complex, with the bladder receiving input from both the autonomic, sympathetic and parasympathetic and somatic arms of the nervous system. Sympathetic is but through the hypogastric nerves. It causes relaxation of the detrusal muscle, promoting urine retention. While parasympathetic through pelvic nerve, increased signal from this nerve causes contraction of the detrusal muscle, stimulating micturition. And the third is somatic through the pudendal nerve. It innervates the external urethral sphincter, providing voluntary control over micturition. In addition to the efferent nerves supplying the bladder, there are sensory afferent nerves that report to the brain. They are found in the bladder wall and signal the need to urinate when bladder becomes full. Now, the sympathetic nerves supply of the bladder through the hypogastric nerve, but the sympathetic nerves only supply the blood vessels and they have no direct effect on the detrusal muscles. Then parasympathetic nerves, by the pelvic nerve, it supply the urinary bladder muscles, and also the both sympathetic and parasympathetic also supply the internal sphincter, while the external urethral sphincter is supplied by the pudendal nerve, which is somatic nerve. Now, bladder stretch reflex. The bladder stretch reflex is a primitive spinal reflex in which the micturition is stimulated in response to stretch of the bladder wall. It is analogous to the muscle spinal reflex such as patellar reflex. The reflex arc. Bladder fills with urine and the bladder wall stretch. Sensory nerves detect stretch and transmit this information to the spinal cord. Now, interneurons within the spinal cord relay the signals to the parasympathetic efferent, the pelvic nerve. The pelvic nerve acts to contract the detrusal muscle and stimulate micturition. Now, when the urine fills into the bladder, it activates the stretch receptors. The stretch receptor signals then go to the spinal cord and it activates pelvic nerve, which then cause detrusal muscles to contract and also relax the internal urethral sphincter. Simultaneously, signals also go to the higher brain micturition center, which stimulate the pudendal nerve, which relax the external urethral sphincter and micturition occur. Now, there are lots of pathologies in the bladder, but I am only discussing spinal cord injuries above and below T12. The bladder has important clinical considerations when it comes to spinal cord injuries. There are two different clinical syndromes depending on whether the damage has occurred. Reflex bladder occur when the spinal cord transection above T12, and flaccid bladder occur when spinal cord transection below T12. In reflex bladder, in this case, the afferent signals from the bladder wall are unable to reach the brain, and the patient will have no awareness of the bladder filling. There is also no descending control over the external urethral sphincter, and it is constantly relaxed. There is a functioning spinal reflex where the parasympathetic system initiates detrusal contraction in response to bladder wall stretch. Thus, bladder automatically empties as it fills, known as the reflex bladder. So, what happens in reflex bladder when the spinal cord transection occur above T12? There are no role of brain. So external urethral sphincter is always relaxed, and when the urine fills, the stretch receptors signal the spinal cord, and the spinal cord then by the uh, pelvic nerve stimulate retrosal muscles, so micturition occur. Now, flaccid bladder spinal cord transection below T12. A spinal cord transection at this level will have damaged the parasympathetic outflow to the bladder. The detrusor muscle will be paralyzed, unable to contract. The spinal reflex does not function. In this scenario, the bladder will fill uncontrollably, becoming abnormally distended until overflow incontinence occur. So when the transaction occur below T12, the stretch receptors sending their input to the spinal cord, uh, and spinal cord will not transmit its signal via the pelvic nerve. So detrusor muscles are unable to contract. So what happened? The bladder become overfilled, and there will be overflow incontinence. And what is urinary retention? Besides neurogenic dysfunction of the bladder, normal bladder emptying may be hampered by any form of obstruction from the level of the bladder neck downwards. In males, the most common cause is obstruction due to prostatic enlargement. Other causes include obstruction by a stone or large blood clot. Acute retention is a medical emergency as the bladder has a normal functional capacity. When it is pushed to the limit due to accumulation of urine in an acutely obstructed reservoir, the patient feels increasingly excruciating pain, and the placement of a urinary catheter alleviates the symptoms immediately. So again, in urinary retention, bladder overfilling occurs, but the cause is different from the flaccid bladder. Chronic retention is a gradual procedure due to incomplete obstruction of the urine outflow. This leads to accumulation of residual urine in the bladder through months or even years. The bladder is therefore progressively distended in volumes that exceed 1 to 1.5 liter of urine. Chronic retention is often accompanied by impairment of renal function. However, no pain is usually present as the bladder is gradually stretched. Chronic retention of urine is often complicated by infections and formation of blood stones due to urine stasis and accumulation of minerals in the urine. Now the question, the pudendal nerve plays no part in innervation of the bladder. It's true because pudendal nerve innervates the external urethral sphincter. The sympathetic nervous system has no motor function in the bladder. It is also true because sympathetic nervous system only supplies blood vessels of the bladder. The main blood supply to the bladder is from the branches of the posterior trunk of the internal iliac artery. It is false because the blood supply of the bladder is derived from superior and inferior vesical arteries, which are branch of the interior division of the internal iliac artery. Lymphatic drainage of the bladder is to the internal iliac nodes. It is true because fundus and the neck drains into the internal iliac nodes, while superior lateral surface drains into the external iliac nodes. And option E, it is derived embryologically from the mesonephric duct. It is false because bladder derived from urogenital sinus. Trigone is a part of the bladder which basically derived from mesonephric duct. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates.